Hi, welcome to day 3 of my live series on zinc deficiency and immunosuppression. I'm your host, Dr. Mihaela Gruita, the naturopathic pharmacist, and today we are going to focus our attention on steroids. Steroids are a synthetic version of steroid hormones that our body naturally makes in the adrenal gland, like the cortisol, and it's a stress hormone. Um, but we know that the steroids work quite wonderfully to decrease inflammation and pain. And because of that, they're widely used in disease states like asthma, allergies, severe allergies, even anaphylactic shock. They are used in autoimmune diseases where we need to depress the immune system, and they are also used for pain, often in the same disease states like rheumatoid arthritis, lupus. Um, and they are also used post organ transplantation to make sure that our body does not reject the new organ that we received. So these are kind of the uses. Um, I'm sure that there's other situations where um, people receive steroids, but these are the most common ones. Also, steroids come in various versions. They come as oral capsules. They can be injected intravenously. They are also in creams that can be used topically. And then they are also inhaled. So that's the most common version used in asthma. Um, Steroids are also used short-term and long-term, and their side effects, the list of the side effects that comes with the steroids is super long. It's more or less, though, dependent on the type of steroids and the route of administration. So, for example, the oral steroids or the injectable steroids will have more side effects than something that's just local, like the inhaled steroids and the topical ones. However, if we use them long term, even if it's topical, it's just local, um, they will not, the steroids can still cause pretty significant side effects. And again, as I mentioned, the list of side effects is super long, but today we're going to focus on um, one side effect, and that is immunosuppression. And these drugs, sometimes they're actually used because of this side effect that they have. But other times, like in asthma, we don't want to be immunosuppressed. What does it mean to be immunosuppressed? In immunosuppression caused by steroids can be one, it can be caused by zinc deficiency because steroids cause zinc deficiency. And we learned in the first week that when zinc levels are low, the immune system goes down. So we develop immunosuppression. But also, steroids will decrease all the white blood cells in our body. And there's a few types of them. So for example, the neutrophils are protecting us against bacteria. The lymphocytes protect us against viruses. Eosinophils protect us against allergies and parasites, and so on and so forth. So, and all the cells will actually be decreased when we are on steroids. So the immunosuppression level can be quite extensive. And again, sometimes we need that, and that's what we are after, like in post organ transplantation. But when you are just taking steroids because of asthma or pain due to rheumatoid arthritis, you might not be interested in all that immunosuppression. So, so then what are we to do? Clearly, steroids do few good things, like taking us out of pain, and also decreasing inflammation. And inflammation is important. Our body develops inflammation for good reasons, and a little bit of inflammation is very important and it's good for us. But when that inflammation stays long term, and it can really cause all kinds of problems, and that is the kind of inflammation that we don't want. But so what are we to do? Should we just go off steroids just like that? Should we just stop them? And my advice is to absolutely never do that. Steroids are, especially if you've been on steroids long term, it can be actually dangerous to just cold turkey go off steroids. So you should never go off steroids cold turkey without the doctor's supervision. So that's number one rule. And number two, that steroid might be saving your life. So if you are post-organ transplant and you're on steroids, that steroid will actually protect your body from rejecting that organ. So there are situations, that's what I'm saying, that there are situations where not being on steroids is more dangerous than being on steroids. So never you should be the one to decide that that's the case. You should always discuss that with your doctor. And but if you do want to help yourself and you do want to maybe counteract some of that immunosuppression, and it's appropriate for the disease state that you're going through, you should basically supplement with zinc, because remember, zinc also, low zinc also causes immunosuppression, and it basically acts on the immune system slightly different than the steroids per se do. And so by decreasing the zinc and then supplementing that zinc, basically we can help to slightly improve that immune system given the circumstances. Well, we can supplement with zinc, or we can even be very conscious that there's lots of foods out there that are very full in zinc. So there's meats like beef, turkey, chicken, I believe, and lots and lots and lots of vegetables. So any diet that's rich in vegetables and proteins, it will be giving you sufficient amounts of zinc. So that's kind of what I had for you today. If you want to ask questions, write them in the comments. I'll be glad to answer them. And if you want to ask questions in a more private context, and ensure that you are surrounded by like-minded people, you can always join my group, Drug Nutrient Interaction. It's a private Facebook group, and over there I do answer questions as well. So I'll see you next week, and we will discuss yet another class of medications, common drugs, that probably a lot of the people out there are on them, and we will see how they affect the zinc levels and the immunity of our body. So have a good evening, and I'll see you in a week.